Heart disease is the leading cause of premature death in women, and in Canada, one woman dies every 16 minutes. Heart disease in women has been understudied because the clinical trials that we rely on to tell us how to diagnose heart disease and how to treat heart disease have predominantly been in men. The symptoms of, for example, a heart attack are different in men and women. So when you typically think of a heart attack, you think of a man. They're clutching the center of their chest. The discomfort goes down their left arm. And although women may present that way, they have a host of different symptoms that represent heart disease. And sometimes their symptoms are very vague. So it just may be fatigue or difficulty sleeping. So you can see how those symptoms may not always alert a woman that she's having heart disease or even a healthcare provider. Because of that, up to 50% of heart attacks in women go unrecognized. We know that men and women's hearts are different. They respond to treatment different, but if you don't study them, you don't know how to optimally diagnose or treat a woman. The purpose of the Women's Cardiovascular Health Clinic is to be comprehensive, so providing a multidisciplinary care, which means that they get expert cardiology care, but also addressing mental health with a mental health expert, social worker, diet and exercise, but that they're getting education about the heart condition that they're affected by, and so that they feel more confident about how they're being treated and why they're being treated. You can imagine that if a woman has symptoms that may not be clearly related to what we think is a typical heart attack, they go to the emergency room multiple times and they're told nothing is wrong. And that's very anxiety provoking. So we want to make sure that the mental health component is really at the forefront along with their clinical care. Women are also at increased risk for having disease of the small vessels of the heart that you can't see by doing a normal test like an angiogram. We need special equipment. Part of that special equipment comes in the form of a non-invasive test called a cardiac PET. Currently, there are only 2 places in Canada that have a cardiac PET, and only one related to a women's cardiovascular health clinic in particular. So we would be providing that test that is currently not available. I'm a heart rhythm specialist and I deal with abnormal heart rhythms. I felt that the expertise that I've gained from the years of training from world-class institutions that I've been in and the research expertise could culminate into helping women and helping women in my own community. Even though we know that heart disease is devastating women, not just in Canada, but around the world, there are only 6 clinics of varying scope and capacity in Canada and only 1 in Western Canada. So this would really provide such a pivotal opportunity for care that currently doesn't exist. I want to thank the Calgary Health Foundation donors. Each of you has a mother, may have a sister or a daughter who is at risk for heart disease or have suffered from heart disease. You are helping to improve the heart health of women in Calgary and southern Alberta.